Hello, student. Today, topic of lecture, urogenital system. Next question, overview of the urinary organs, anatomy of the kidney, anatomy of the renal pelvis, calyces, and urethra. Next question, anatomy of the urinary bladder, urethra. Urogenital system urogenitale, consists of the urinary organs and the reproductive or genital organs, organa genitale. These organs are closely related developmentally, and in addition, their excretory duct as a unit to form a single urogenital tube. The urethra in male or drain into common space, the vestibula of the vagina in females. Organa urinary include in male pelvis renalis, urethra, vesica urinaria, urethra masculina. Organa urinaria in females, pelvis renalis, urethra, vesica urinaria, urethra feminina. Organa genitalia feminina interna and organ genitalia masculina interna, you will study on the next lecture. The urinary organs. The urinary organs are two kidneys, ureters, urinary bladder, and urethra. The kidneys have a wide range of functions. Due to its regulation of fluid and electrolyte balance, it is an absolutely indispensable organ. Its functions are excretion of the urine, the body's own and foreign substance, regulation of fluid, electrolytes and acid-base balance, endocrine function, erythropoietin, renin, calcitriol. The efferent urinary tracts concerned with the storage and excretion of the urina. The kidney or ren or nephros is a parenchymatous organ with a reddish-brown color, bean shape. It's located in close proximity to the adrenal gland, an endocrine organ. In the retroperitoneal space behind the parietal peritoneum of the upper abdomen. The kidneys are 10-12 centimeters long. Uh, 5-6 centimeters wide and 4 centimeters thick organ with a weight of 120 to 100 grams, average 150 grams. They have superior kidneys, has superior and inferior pole, extremitas superior and extremitas inferior, anterior and posterior surface faces anterior and faces posterior, medial and lateral border, margo lateralis, margo medialis. At the medial border is hilus renalis, where the vessels and the urethra enter and exit. Artery renalis enter, exit vena renalis. Arteria renalis and nerves enters into the hilum renale of kidney. Vein renalis, the urethra and lymphatic cells exits from the hilum renal or the kidney. All these structures forms renal pedicle or crus. This is, you see, glandula suprarenalis. Superior and inferior pole, anterior, posterior surface, medial body or margo medialis, margo lateralis. It is hilus renalis. The kidneys extend from the level of the 11th or 12th thoracic vertebra, superiorly to the 3rd lumbar vertebra inferiorly, and so they receive some protection from the lower two ribs. The right kidney is crowded by liver, and lies slightly inferior to the left kidney. This left kidney, right kidney. The kidney have a threefold fascial system. The fibrous capsula, capsula fibrosa, the perineal fat capsula, fat capsule surrounds the kidney and adrenal gland, the renal fossa renalis. Capsula fibrosa surround the kidney. Organ capsula of dense connective tissue is located directly on the surface anatomy of the parenchyma. Capsula adiposa. A fat capsule surrounds the kidney and adrenal gland. The renal fossa renalis. It is a fascial sac is open in the inferior medial side for passage of vessels and nerves and urethra. The anterior layer of the renal fascia is referred to clinically as Gerot's fascia. The posterior layer merges into the muscular fascia of musculus psoas major and musculus quadratum lumborum. Musculus psoas major, musculus quadratum lumborum. Capsula adipose, capsula fibrose, renal fascia, divided two layers. Fascia, anterior layer of renal fascia and posterior layer of fascia renalis. Internal growth anatomy. A frontal section through a kidney reveals two distinct regions of kidney tissue. Cortex renalis, and medulla renalis. The most superficial region, the renal cortex, is light in color and has granular appearance and pars radiate nephron loops. Pars convolute the renal corpuscle corpuscle, the proximal and distal convoluted tube. Renal cortex include granula and pars radiate. It is nephron loop and renal corpuscle. Deep the cortex is a dark renal medulla, which consists of cone-shaped masses called renal pyramids. The broad base of each pyramid abuts of cortex, whereas the pyramid apex or papilla point internally. The renal pyramids exhibit striation because they contain roughly parallel bundles of tiny urine collecting tubula. The collecting tubula are opened on the apex of the pyramids, and it forms area cribrosa. This is area cribrosa. The renal column inward extension of renal cortex separate adjacent pyramids. You see coronal section through the right kidney and suprarenal gland. This is posterior aspect. Renal pelvis has been opened and the fatty tissue removed to display the renal vessels. You see cortex. This is medulla, pyramids, calyx, and you calyces, capsule. The human kidney have lobes, each of which is a single renal pyramid plus the cortical tissue that surrounds that pyramid. There are 5 to 11 lobes and pyramids in each kidney. Lobes. The tips of the pyramid, papilla renalis, flow into the renal calyces. This is calyces renalis majoris and minoris. This is minoris, this is majoris. Where urina is the renal pelvis, pelvis renalis. You see pelvis renalis. The renal pelvis is located together with adipose, tissue and vascular, lymphatic and nervous system in recess of the kidney parenchyma, sinus renalis, which is connected to the hilum renale. Located in the hilum are vein renalis, anterior, artery renalis, and renal posterior, renal pelvis posterior, pelvis renalis posterior. The kidney parenchyma consists of nephrons and collection duct, in which urine is altered by filtration out the blood with subsequent reabsorption and secretion. Finally, at the top of the papilla, the collection ducts release the urina into renal pelvis. Main structural and functional unit of the kidney is nephron. Nephron include first renal corpuscle, include glomerulus and glomerular capsule. The second, the proximal convoluted tubula. The U-shaped nephron loop. Next, the distal convolute tubula. Urine passes from the distal tubulus of the nephrons into the collecting duct, each of which receives urine from several nephrons and runs straight through the cortex into the deep medulla. You see structure of cells, every part of nephron. This is epithelium. For example, epithelium proximal convoluted tubular cells. It is distal convoluted tubular cells in distal convoluted tubula. And structure, collecting duct, what you see, epithelium, which form collecting duct. Classes of nephron, classification of nephron of kidney. The nephrons are divided in two categories according to location. Cortical nephrons are 85% of all nephrons. They are located almost entirely with cortex, with the nephron loop dipping only short distance into the medulla loop. Juxtamedullary nephrons 15% of all nephrons, the renal corpuscula, are located near the cortex medulla junction. Juxtamedullary nephrons have nephron loops that deeply invade the medulla and thin segments that are much longer than those of cortical nephrons. These long nephron loops, in conjunction with nearby collecting ducts, contribute to the kidney's ability to produce a concentrated urine. Collecting duct contribute to the kidney's ability to produce concentrated urine. Cortical nephrons, juxtamedullary nephrons. Urine flowing from the papillary foramina passes on the way to the urinary bladder through the lesser calyces, the greater calyces, the renal pelvis, and the urethra. This is lesser calyces, this is greater calyces, this is urethra. And you see lesser calyces. Each renal calyx, the lesser calyces, surrounds the cortical renal papilla like a double-walled goblet. As a result, the proximal part of the calyx around the base of papilla is elevated above the axis of the papilla as fornix. The wall of the fornix contains smooth muscle fiber, musculus sphincter fornix, which together with connective tissue embedded here and enjoying nerves and blood and lymphatic vessels constitute the fornical apparatus of the kidney. It plays an important role in excretion of urine from the renal parenchyma into the renal calyces and prevents the return of urine from the calyces into renal tubula. This is fornical apparatus of the kidney. Pelvis renal. Kidney has segmental structure. The kidney contains 4 tubular systems: artery, veins, lymphatic vessels, and renal tubulus. The branches of artery renalis divide the kidney with their supply areas into 5 segments: segmentum superioris, segmentum anterius superioris, segmentum anterius inferioris, segmentum inferius, and segmentum posterius. What do you see? Segmentum superior. What do you see? Segmentum superior, segmentum anterius, segmentum posterius, and segmentum inferius. There's 5 segments. The kidney has 5 segments. You see picture which demonstration major blood vessels. This is way from heart to heart. Outer renal artery, segmental artery, interlobular lobar artery, aqueous artery, cortical radiate, afferent arteriole capillaries, and efferent arteriole, the cortical radiate vein, aqueous vein, interlobular vein, renal vein, and inferior vena cava. This is a renal vein draw into inferior vena cava. What is the path of blood flow through renal blood vessels? The renal pelvis is surrounded by adipose tissue in the sinus renalis of the kidney. Renal pelvis, a flat funnel-shaped tube, is supply the expanded superior part of urethra. This is, you see, minor calyx. What do you mean? This is major calyx. This is renal pelvis, urethra. This is, you see, renal cortex, renal medulla. Urethra is 25-30 centimeters long and has diameter of approximately 5 millimeters. It transports urine by regularly occurring peristaltic waves and is divided into 3 sections. Pars abdominalis, you see pars abdominalis, pars pelvica, and the pars intramuralis. Pars abdominalis in the retroperitoneal space. Pars pelvica located in the is located in the lesser pelvis, and pars intramuralis transverses the urinary bladder wall. Urinary bladder wall. The urethra leaves the renal pelvis in the inferior medial direction and firstly crosses the inferior renal pole. The urethra has 3 constrictions. At the outlobe of renal pelvis, in area of the inferior renal pole. Second constriction at the intersection of arteria iliaca communis, or externa. And second constriction of urethra. And next at the passageway through the wall of the urinary bladder. This is third urethra constriction when it passes through the urinary bladder wall. This is pars intramuralis, located into wall of vesica urinaria. Urethra, 3-part: pars abdominalis, pars pelvica, pars intramuralis. 3 constriction. This is near renal, in the area of inferior renal pole. Intersection of the vasa iliaca, and 3 constriction into urinary bladder wall when it passes through the urinary bladder wall. 3 constriction, 3-part. Now you see pyelogram. This X-ray image was obtained using a contrast medium to show ureters, kidney, kidney, and bladder. This it is X-ray image. Urinary bladder. Vesica urinaria lies subperitoneally and is covered on its superior side by the peritoneum parietale of the pelvic cavity. Peritoneum parietale of the pelvic cavity. The urinary bladder has a capacity of 500 and 1,500 milliliter. Urinary bladder is divided: body, apex, bladder base, and neck of bladder. Corpus vesica, apex vesica, fundus vesica, and next vesica. At the fundus, the exit the exit of the urethra, what you see, ostium urethra internum, what you see, forms together with confluence found on both sides of the urethra, ostium urethris. The trigonum of the bladder. Trigonum vesica. What do you see? Trigonum of bladder. What do you see? You see ostium urethra. What do you see? Trigonum. This you see bladder neck. Bladder neck. And uterina, uteric orifice. Orifice. This is ostium ureteris. Ureteris. Trigonum. You see position of the urinary bladder in reference of the pelvic organ male and female. The bladder is surrounded by paravesical adipose tissue and secured by various ligaments. Ligamentum umbilicale medianum contains the relic of allantoic duct, runs from the apex of the urinary bladder to the navel. Ligamentum pubovesicale, ligamentum pubovesicale traverses the spatium retropubicum, and this woman is anchored of the side of the neck of the bladder on the posterior side of the pubic bone. Pubic bone. What you see? Ligamentum pubovesica. Ligamentum pubovesicalis, ligamentum umbilicale medianum. Vesica urinaris. The bladder is surrounded by paravesical adipose. What you see? Tissue and secured by various ligaments. Ligamentum umbilicale medianum runs from apex of the urinary bladder to the navel, and ligamentum puboprostaticum, ligamentum puboprostaticum, corresponding ligament in men. Behind the urinary bladder, the peritoneal cavity in both sexes is extended caudally to recesses. It is excavatio vesico-uterina, excavatio recto-vesicalis, separate urinary bladder from the uterus and rectum in both women and men. In men, recto-vesicalis, in men too, excavatio vesico-uterina, and excavatio recto-vesicalis. Urethra. The urethra is formed very variably in both sexes. The female urethra is 6 millimeters wide and at 3-5 centimeters, very short, and enters directly ventral of the vagina into the vestibula of the vagina. Short urethra, feminina. The male urethra is relatively long at 20 centimeters and is divided into different sections. Pars intramuralis, 1 centimeter, and pars prostatica, pars membranacea, pars spongiosa, pars intramuralis in the urinary bladder wall. It begins at the ostium urethra internum. Pars prostatica transverse the prostate. Here the ductus ejaculatory, common exit duct of ductus deferens and seminal vesicle, confluence with colliculus seminalis and the prostate gland bilaterally. Pars membranacea at the passage through the pelvic floor. Pars spongiosa, pars or pars spongiosa runs within of the corpus spongiosum of the penis up to the external orifice, ostium urethra externum. Here, glandula bulba uretralis and the glandula urethra flow into each other. The proximal section is also somewhat wider and is sometimes referred to as ampulla urethra. The male urethra has two curvatures. At the transition from the pars membranacea and to the pars spongiosa, and in the middle section of the pars spongiosa, and the following constriction: ostium urethra internum and ostium urethra externum. Goodbye, student.